So I'm Dr. Uday. I am a dentist. I'm a BDS and MDS. My master's is in oral medicine and radiology. Then I have been working in a healthcare analytics company, Mediva, which has been there for past 13 years. And now they have evolved into a product platform, which is an analytics embedded electronic health record. That's where I work as GM Clinical Operations. Since 4 years, I've been in this position. I have also completed 1 year course in data science, and after having completed that course, I had joined this course by FORE School of Management. I'm also a Six Sigma Black Belt. It was very well structured. The course delivery was also very appropriate, and there were many students in the program. And I think my interactions with them also was well organized and structured. The classes were sequential in nature, and the approach that the course has taken was very methodical in terms of it was made for doctors. I am trained in Python, but the course was organized using graphical user interfaces, which will be very useful for citizen data scientists, especially the doctors. So it was very well organized. The faculty was great. All of them, Dr. Vinay Ghosh Mishra sir, Dr. Ardhaya Roy, and of course Dr. Ashok Karnal sir. His lectures were very informative. He went into the depths of deep learning, and I had not experienced this kind of theory in my previous course. Of course, that course was not on deep learning, but still, it helped me a lot in understanding the theory as well as looking at the GUIs. Especially, it was very useful. So it is definitely up to the management of the course on how they would want to structure it. My opinion will be biased because I'm a data scientist as well and a doctor. So according to me, they should also add Python as a training curriculum in the training curriculum, but the duration of the course was approximately 3 months. So I don't think in 3 months they'll be able to add Python because it will take definitely longer than that. But a small exposure to Python and a brief explanation of the coding part will be important, so that right now the majority of the students in this course were established doctors who wanted to understand data science. I'm assuming that this course will then become a course which young doctors will also want to take up, who are not working for the government or an established company, but are planning to do this course to establish themselves in the field of data science in healthcare space. So for those students, they would definitely want a small exposure to Python, so that if the teachers can explain this in the course and they can do self-learning, that will of course be very important and very relevant. And also the theory on machine learning. So the theory on deep learning is great. Anybody who takes this course will find that very useful. What is artificial intelligence? What does it mean? What is a convolution neural network? How does computer read images? All of that theory is excellent in this course. I think that machine learning part, which would be the theory of advanced statistical models, will need greater explanation, so that students who don't really have any background in statistics are able to also appreciate the theory behind machine learning concepts. That I think can definitely be added upon. So I was exposed to a number of problems that were given. Data as well as the problem statement was provided very clearly. I've done maybe more than 10 or 12 such projects where the problem statement was given and we had to bring up a solution. And I learned about a number of different approaches. So the exposure to the GUIs was excellent. So if there is a doctor, so if any doctor listens to this, my recommendation to you would be, if you don't have a lot of experience in data science, then this is the best course for you, because the faculty will teach you how to do advanced data analytics without really making you uncomfortable with all the coding. And it is an excellent course for more senior doctors who have a data science team, or who plan to get into data science team, who will be principals and leaders in data science community and want to also understand how all of this will be done. It is a perfect course for them right now, as it is right now. So I learned a number of things. We had heart disease data set, we had ECG data set, we had identification of the classification of tumor using MRI images, we had COVID chest X-ray data set. So learned a lot of things, lots of content domain related tricks, as well as the GUI interface tricks, lots of them. I would absolutely rate it 10 on 10. There is no doubt about it. Why? Because there are currently there are no healthcare analytics courses in the market. There are no such courses available. And I would applaud FORE School of Management for setting up such a course. And the whole healthcare community in the country will align themselves with your leadership, and the shape will come automatically. But it is the initial step that has been taken, and it's a wonderful step. And I'm sure the community as well as the school management will take it much further. I will definitely recommend it to my colleagues, and if there are any colleagues who are listening to me, please just take up this course without thinking. It's definitely going to change your perspective on how you look at data. So I would definitely say, if you're planning to shift from statistics to analytics, this is definitely the best.